Good morning, Ma'am Eliza. My name is Julia Ampalia, the same nurse from your previous visit, and this is your 6th day of session. Good morning to nurse. How are you, Ma'am Eliza? I'm okay. What do you mean by okay? I'm okay because I don't have any illness. Still adjusting with me being a mom. It's tough, but I'm happy because I have my loved ones support. How about your boyfriend? How is he? He is okay. He has a busy schedule at work. Do you mind if I ask about your sexual activities? It's okay, no problem. You can ask anything about it. What contraception are you using? We use condom for usually. I don't want to use pills because I have difficulty remembering things. How about other options such as depo shot? What are your thoughts about this contraceptive? I don't want to take the depo shot because I heard that it has many negative side effects. And I do not need contraception because I do not have sex since I delivered my baby. And still don't have plans having sexual intercourse yet because of our busy schedule. You do not want to use contraceptives because you do not foresee yourself having sexual intercourse yet because of your busy schedule. What are your plans for the future? Yes, my plans are to focus on taking care of my newborn and will work after I recover. I don't have any plans of having another baby yet. Birth control methods helps a couple to have a good family planning that prevents unintended pregnancy or unplanned. What are the negative side effects about depo shot you mentioned earlier? Yes, I heard that depo shot can have a negative side effect, like it can cause blood clots and causes the bones to become weak and brittle. Depo shot is a kind of birth control and it's an injection that a patient receives every 3 months. The effectiveness rate of this method is almost 100%, and the most common side effect of this depo shot are changes in your period, weight gain, and headaches. Some known side effects are it decreases your bone density, that increases your risk to develop osteoporosis. But only some women develop these kind of side effects. And this risk can be prevented by taking adequate calcium included in your diet and of course engaging to weight-bearing exercise daily. Other myth about depo shot is still not proven by FDA. Oh, okay, now I have a clear understanding about it. Is there anything you want to talk about or clarifications? I don't have plans of having another baby yet, and because of the information you provided, I might consider being on a birth control. But I still don't know what option suits for me. There are many kinds of birth control, but the most effective, based on its effectiveness rate, is implant, with a 100% failure rate. It is inserted with the use of local anesthesia during your menses to make sure that you are not pregnant during the insertion. The advantage of it is it can be used during breastfeeding without effect on milk production. And because you are breastfeeding, you might want to consider it. Other safe options are pills and condoms. Oh, I will discuss it first with my boyfriend regarding these methods before we decide whether I take this contraception or not. What other concerns, questions about any of those options do you have? Tell me more about it. Is this implant method affect or inhibit sexual activity? You know, in case my boyfriend will ask me about it. Implants do not inhibit sexual activities. It is safe during sexual practices. Okay, great. I will talk to you as soon as we have been decided. Before we end the session, can you state or summarize the information I've been providing earlier? The negative side effects of depo shot were all myth and not yet proven. Still, I need to consider having birth control method for me to prevent having unplanned pregnancy, and implant method has the most effective rate, and I might consider having this after discussing it with my boyfriend. If you do not have any other concern, I will end our session here. Have a nice day. Goodbye. Yes, I don't have any questions. Thank you so much for this day. I learned a lot.